let it happen with vapes. Have the courage to say no to big tobacco. The health of a nation depends on it. Thank you. I now recognize Ranking Member Cloud for your opening statement.
Thank you, Mr. Chairman. We have known for decades that cigarette smoking is dangerous and linked to cancer and other illnesses. Smoking causes 480,000 preventable deaths in America each year. That's more than 1,300 deaths a day. And I cannot think of another product on the market where 50% of its users want to quit the product. If you're under 21, you should definitely not use tobacco or begin using vaping products, or for that matter, any other drug or anything else nefarious you should put in your body. It's really important to understand that, especially for young teens, as your bodies are still developing, these products can have an even outsized greater negative impact on growing and learning and those sort of things. Unfortunately, as we've covered in past hearings, severely misguided marketing efforts contributed to what has become a vaping epidemic among teens and communities across our nation. Social sourcing, coupled with nefarious counterfeit and black market products, found their ways in the hands of far too many teens and led to tragic and heartbreaking outcomes for far too many families. We made some progress with the passage of T21, but there's still more work to be done. There's some evidence that this is a new industry, and some evidence is coming forth that may lead that vaping products could help with smoking cessation. If that's true, I hope the FDA will take a good look at the science based on it, but we need to do everything we can to make sure that our youth do not have access to these products. I share, along with the chairman, our first role before being a member of Congress is that of a father, and we do not want to see a world where kids have access to these sort of products. So I want to thank you all for being here today. I want to thank you for attending this hearing. I want to thank you also, Dr. Woodcock, for appearing for us today. Hope that we'll be able to have a good, healthy discussion, that we'll be able to hear from you, but also make sure we're not unduly influencing improperly a process that's supposed to be evidence-based, and hopefully it will be, and that we'll be able to do the right kind of science of being able to divide how we can protect our kids, yet if the science does point out that this is a smoking cessation device, that we'll be able to have the right adults have access to that product as well. Thank you, Chairman, for this hearing. Thank you for your passion on this topic, and I yield back.
Thank you, Mr. Cloud. I want to just applaud Mr. Cloud for being part of the bipartisan and bicameral congressional caucus against youth vaping, which myself, Senator Durbin, and others are chairing. So thank you so much, Mr. Cloud. Now, Chairwoman Maloney, thank you for being with us. And thank you for your distinguished leadership of our committee. I want to just recognize you for a brief opening statement as well.
Thank you. Our nation's youth are experiencing a public health crisis. According to data collected by FDA and CDC, more than 3 million high school students and 500,000 middle school students use e-cigarettes. And according to the Office of Surgeon General, an estimated 5.6 million children in this country will die early from a smoking-related illness if cigarettes can continue to be used at this rate. That's 1 in every 13 young people alive today. These numbers are horrifying. They threaten years of progress in reducing youth tobacco use, and the e-cigarette industry is to blame. Companies like Juul and Puff Bar knowingly and deliberately pushed tobacco products onto our nation's youth. They deployed deceptive, dishonest tactics to get our young people hooked on these products. They even went so far as to promote their products directly in our nation's schools. E-cigarette manufacturers have acted with a complete disregard for the health of young people across this country. Their actions are appalling, and the federal government can no longer allow this industry to foster youth addiction as a long-term marketing strategy for its deadly products. Our nation's regulatory agencies must take immediate action to turn the tide on this crisis. FDA can build on the steps it's taken so far by prohibiting the sale of remaining flavored products, capping nicotine level in e-cigarettes, and pulling illegal products like those sold by Puff Bar, off the market. I strongly urge the agency to take these common sense steps. Let me conclude by commending the leadership of Chairman Krishnamurthy and the Subcommittee on Economic and Consumer Policy. The subcommittee's investigation has brought to light the dangerous practices of e-cigarette manufacturers across the country, and it has underscored the urgent need for the federal government to act on America's youth vaping epidemic. Thank you for your leadership, Chairman Krishnamurthy. I look forward to hearing the testimony and from all of our esteemed witnesses today, and I yield back. Thank you.
Thank you,
It's an
Chairwoman
honor to be with
Maloney,
you.
and thank you for your distinguished leadership. Thank you for your opening statement. Now I'd like to begin by introducing our first panelist, someone I know very well, the distinguished senator from my own home state of Illinois. For decades, Senator Dick Durbin has fought to protect all Americans, including our society's most vulnerable, from the dangers of tobacco and e-cigarettes. His work dates back to leading the congressional effort to have smoking banned on airplanes, a measure that went into full effect in 1990, more than 30 years ago. Today, I'm grateful to consider Senator Durbin a champion and a partner in our shared effort to curb youth vaping. He is the Senate lead of the Congressional Caucus to End the Youth Vaping Epidemic. He is the Senate lead of our legislation, the Tobacco Tax Equity Act, which will raise taxes on all tobacco products for the first time in over a decade to protect public health. He is the Senate lead of the PREVENT Act, legislation to create youth vaping prevention programs in schools. And this is just a small snippet of the work that Senator Durbin has engaged in this space for decades. Senator Durbin, in his spare time, is the Majority Whip, the chairman of the Senate Judiciary Committee, and a long-standing dean of the congressional delegation from Illinois. We are so fortunate to have him here today and thank him for his participation. Senator Durbin.
Thanks, Chairman Krishnamurthy and Ranking Member Cloud, for allowing me to testify today on the youth vaping epidemic and the role of the Food and Drug Administration. The campaign to reduce tobacco use and prevent our kids from a lifetime addiction is personal to me. My father died from lung cancer. He was 53 years old. He smoked 2 packs of Camels a day. And as a young high school student, I'll never forget how he struggled to breathe during my visits to the hospital in his last days. Cigarettes are responsible for 480,000 deaths every year in the United States. My family is certainly not the only one who can tell this story. So ever since I came to Congress, starting in the House, I have dedicated my career in public service to this fight, holding the tobacco industry accountable for its lies and deception, empowering families, schools, and healthcare providers to prevent kids from this addiction, and working to build and strengthen a regulatory framework that really does focus on public health. When last I testified before this subcommittee in July of 2019, seems so long ago, most of our focus was on the skyrocketing rates of youth e-cigarettes, fueled by the kid-friendly flavors, aggressive promotion, and high nicotine concentration of the product. Since that time, my office, this subcommittee, and the public health community have shown a bright light on the abusive tactics by Juul that contributed to this foothold with our children. We now have uncovered the disgusting tactics used by this company to addict our children on these e-cigarette products. I'm pleased our public health and antitrust regulators have started to step in. But what I want to focus today is the record of the FDA over the last several years and the opportunity that sits before the agency today to correct its missteps in the past and put public health and kids at the forefront of its mission. Flavored e-cigarette products have exploded in popularity among our kids. Nearly 4 million now vaping, a 361% increase in just 8 years when only 800,000 kids were vaping. 1 in 5 high school students use e-cigarettes. These alarming trends are erasing the historic progress we've made reducing youth tobacco use. Who's the cop on the beat to whom we entrust our children? It's the Food and Drug Administration. And this agency has been timid and reluctant for way too long. For years, the FDA delayed implementation of its requirement that companies submit PMTA applications for review. At the same time, the FDA allowed cigarettes to proliferate, essentially unregulated, e-cigarettes to proliferate, essentially unregulated, failing to enforce its own deeming rule, which required that all new products entering the market after August 8, 2016, undergo a public health review. Since my last testimony, we had a glimmer of hope on that day in September 2019 when President Trump promised to ban all e-cigarette flavors. As part of that, the FDA in January of 2020 had a golden opportunity to finally clear the market of these addictive, kid-friendly products, the vast majority of which were on the market illegally. But instead, the Food and Drug Administration took a half measure, only partially clearing the market and leaving major loopholes for this powerful industry. The result? Kids migrated to these loopholes, to the products that remained unregulated on the market, menthol-flavored e-cigarettes and disposable vaping products. The use of disposable e-cigarettes, one of the loopholes which the FDA lost, which were exempted from the FDA's January 2020 action, increased 1,000% last year. Make no mistake, kids get it. If we don't take this seriously across the board, they will find those loopholes and continue their addiction. And because the FDA allowed menthol-flavored cartridges from Juul and others to stay on the market, listen to this, the use of these menthol-flavored Juul products, cartridges, increased from 11% to 62% of the market. Another failure by the FDA. Now we approach one of the biggest milestones in FDA tobacco regulation history, and I worry the agency is going to fail again. After years of delay by administrations of both parties, the FDA, under court order, finally required e-cigarette and tobacco manufacturers to submit applications for their vaping products on September 9, 2020. This is the long-awaited opportunity for the FDA to apply a public health standard that Congress passed as long ago as 2009 in the Tobacco Control Act, to evaluate whether a product can stay on the market and whether it is, quote, appropriate for the protection of public health. That is a high bar. It requires the FDA to balance the risk of youth initiation with potential benefit of adult cessation. And the burden is on the manufacturer. The burden is on the manufacturer to show their products will not lead to youth use, show their products do not harm the user, and to show they actually help adults quit smoking. Remember that claim made over and over again? Prove it. You can't. They know they can't. I'm deeply troubled by what I've heard from the response of the FDA to my letters. I fear they're going to once again overvalue the unproven potential benefit of cessation for adult smokers while undervaluing the clear evidence of what's happening to our kids. Only 4% of adults use e-cigarettes, 20% of high school students. Kids who never would have picked up a tobacco product are vaping. It's simple. Any product with a history of increasing youth use must be rejected by the Food and Drug Administration, especially flavored products that we know hooks the kids. This is a Super Bowl for the FDA's tobacco effort. I'm afraid they're not ready for prime time. I hope they prove me wrong. The FDA recently announced plans to ban menthol cigarettes, an important public health action, and I want to commend the acting commissioner who sits behind me on when she called me with the news. But just like that step, the time is now for FDA to take meaningful action on how it applies public health standards to e-cigarettes. We know FDA's after-the-fact enforcement, warning letters, and perpetual game of whack-a-mole just doesn't work. To put it bluntly, FDA's slow-walking and refusal to forcefully act has enabled these e-cigarette companies to addict a new generation of our kids. It's time for the FDA to be a partner in public health, not a partner to big vape, and take these products off the market. As the subcommittee continues to examine the youth e-cigarette epidemic and the role of FDA, I hope we prioritize our kids. Let me close with a personal note. It's been a few years, but I once served in this House of Representatives, in this building, in the House Appropriations Committee. And one day I decided to offer an amendment on a transportation subcommittee bill that I served on to ban smoking on flights of 2 hours or less. Why did I pick 2 hours? Because one of the leaders on the Democratic side in the House Appropriations Committee, Martin Sabo of Minneapolis, was a chain smoker. And I asked him once, Martin, how long could you go without a cigarette? He said 2 hours. And that's what I put in the first bill. Flights of 2 hours or less, ban smoking. What happened afterwards was incredible. Even with the opposition of the House Republican and Democratic leadership, I managed to get this to the floor thanks to a man by the name of Claude Pepper, who was chairman of the Rules Committee, and basically ignored the Speaker's direction to give me a chance on the floor. How about that? I had Bill Young of Florida, Republican, as my co-sponsor. We went to the floor and we won. It shocked everybody that we won. Why did we win? Because it turned out the House of Representatives was the biggest frequent flyer club in America, and they were sick of smoking on airplanes. Well, eventually, we banned it on all flights, going beyond 2 hours. I didn't know it at the time. I really didn't know it at the time. That was the tipping point. At that point, people said to themselves, if it's unsafe, if secondhand smoke is dangerous on an airplane, why is it safe on a train, on a bus, in an office, in a restaurant, in a bar? And the dominoes started to fall. And we're at a much different place in America today because as a junior member of the House of Representatives, I tried something that was considered politically impossible, and it worked. You can do the same thing. You have that power at your hands. I hope you'll use it. I know this hearing is an indication of your interest in the subject. Not only give the FDA the tools, but make them use it if they won't. Bring them around to the side of protecting public health. You'll be glad you did. Thanks for letting me testify today.
Thank you, Senator Durbin, for your excellent remarks. And we very much appreciate your second visit on this topic, hopefully your last. Hopefully this will be our last hearing, because now we are going to adjourn this panel and invite Commissioner Woodcock to come to the table and tell us how we're going to get the FDA to do the right thing here. So thank you. Thank you, Senator. Clerk, could you please play the video that has been prepared for the public here?
I started vaping at 17 years old with a Juul, and I then proceeded to use Sorens, air bars, puff bars, boulders, any type of vaping device that there's out there. I probably bought and used it. I think it's really, really important for older generations, people in schools, state governments, federal governments, people working for the FDA. It's so important for them to understand the severity of the epidemic that's going on with vaping with people in my generation. It almost seems like everything about the product, the color, taste, smell, marketing of it is all comprised to get people my age and younger addicted. And luckily I quit 6 months ago and I haven't touched anything since. And it's been quite an adjustment to explain to people in my peer group why I quit nicotine, why it's bad for us, and what they just can't understand is happening or might happen to their bodies, because that's the other thing with nicotine, is that we just don't have any long-term research with these vaping devices, what will happen to our bodies and what will happen to people what will happen to people with long-term use.
Hi, my name is Samantha Boy, and my daughter is 18 years old. She's been addicted to the Juul product since she was about 13, 14 years old. She started out vaping mango, but now her favorite flavor is menthol because she can no longer get her hands on mango. I would like the FDA not to legalize menthol. I will tell you that all the kids that are vaping are only vaping because of flavors, including menthol.
I used products that were primarily the fruity flavors of Juul, Enjoy, Alto, Puff Bar, and even some of the menthol products. And I definitely believe that the industry marketed to people like myself, people that were in high school, and unfortunately they were very, very successful in getting a lot of my friends and myself addicted to their products.
And it's very interesting because within my peer group, we are all health science majors. So we know the effects of vaping. We know that it's not better for you than cigarettes. We know that it's still harming our bodies, but they're so easy to get access to. They're so easy to carry around. You can vape literally in a classroom and no one would know unless they're looking at you blowing smoke out. And you can just have it in your pocket, transport it with you everywhere, and it tastes good. There's different flavors. Mango personally was one I really liked when I was vaping. And again, like I said, everyone else around me, despite the fact that they knew better, were also vaping.
Hello, my name is Paula Costello. I live in Wilmington, Delaware. This is my son, Walter DeBruin. He passed away when he was 19 years old. He started vaping when he was 16. I found some dual pods in his room. That's how I discovered he started with fruity flavors like mango and mint. And I then found out that he was severely addicted to this and he was unable to stop. He was so addicted, in fact, that he was rushed to the ER on several occasions. The last time before he passed away, he was rushed to the ER and they had to bring him back to life. And he still was unable to quit vaping. That's how addicted he was. The FDA should have been looking out for me and my family, my kids, all the kids in the US. Those products never should have been on the market and never should have been marketed to kids. Walter died way too young. His death was unnecessary. And now the FDA has a chance to make a difference. So please don't allow those products like this on the market ever again. Thank you.
The FDA pushed back by several years the deadline for these e-cigarette and vaping companies to have the FDA determine whether or not these products are safe for public use. I, along with many other kids in my generation, got addicted to nicotine and these products in that time that you allowed these companies to sell their products. What do you have to say now to me and everyone else who got addicted and now we know that these things aren't safe?
Thank you for playing that moving video. Good morning. We are now introducing panel 2. We are joined today by the Honorable Dr. Janet Woodcock. Dr. Woodcock is the Acting Commissioner of the Food and Drug Administration. Commissioner, thank you for being with us today. I will begin by swearing in the witness. If you would please rise and raise your right hand. Do you swear or affirm that the testimony you are about to give is the truth, the whole truth, and nothing but the truth, so help you God? Thank you. Let the record show that the witness answered in the affirmative. Thank you, and please be seated. The microphones are sensitive, so please speak directly into them. Without objection, your written statement will be made part of the record. With that, Commissioner Woodcock, you are now recognized to provide your testimony.
Thank you, and good morning, Chairman Krishnamurthy and Ranking Member Cloud. Thank you for the opportunity to be here today. This is a very important issue to me. I'm here today representing hundreds of staff at the FDA who are working every day to prevent kids from using any tobacco products, including e-cigarettes. While I've only been in my current position for about 6 months, I've been with the agency in various capacities for over 30 years. While director of the FDA's Center for Drugs, I played a central role in the agency's initial attempts in the early 2000s to regulate e-cigarettes under our drug and device authorities. Particularly, I was worried that flavors would entice children to use these products, and that would cause harm. The issue ultimately was adjudicated in the 2010 Cetera court case, where the D.C. District Court ruled that products made or derived from tobacco could only be regulated under our tobacco authorities. And now, as acting commissioner, I'm happy to continue to work closely with my colleagues from the Center for Tobacco Products. It is a new day, and we now have a tremendous opportunity and indeed a responsibility to keep and elevate kids at the forefront of our efforts to prevent death and disease from tobacco products. With the September 9th, 2020 pre-market application deadline behind us, we're taking steps to transform the tobacco marketplace towards one where deemed new tobacco products on the market, like e-cigarettes, will have undergone careful science-based review and oversight by FDA. This is truly significant. We've received and initially processed submissions that cover more than 6.5 million products. Congress granted us a vital public health tool with our pre-market review authorities, and I can assure you we intend to use that authority to protect kids and optimize public health as directed in the statute. We're working furiously on application review in order to move on from sort of a Wild West unregulated marketplace. We will complete thorough evaluations to ensure that any products that are granted marketing orders meet the statutory standard of appropriate for protection of the public health. As Senator Durbin said, a high bar. If data for a product do not clearly support that standard, which includes an evaluation of the impact on youth initiation and use, we will not issue a marketing order for that product. At the end of the day, we're going to do everything we can to end the epidemic of youth use and prevent another generation of kids from becoming addicted to tobacco products. Importantly, we're going beyond pre-market review. While the 2020 National Youth Tobacco Survey showed an encouraging and significant decline in youth e-cigarette use last year, there's still 3.6 million middle and high schoolers who currently use these products. The epidemic of youth vaping threatens to undermine decades of progress in reducing the impact of tobacco on public health. So we're also focusing our enforcement efforts against any product where the manufacturer fails to take adequate measures to prevent youth access, and any product that is targeted to youth, and we've been doing that. For example, we've issued warning letters to companies for illegally marketing unauthorized and kid-appealing tobacco products, such as a backpack and sweatshirt with hidden pockets to conceal e-cigarettes, or those that resemble smartwatches or children's toys. In addition, as of May 31st, we've issued over 120 warning letters to firms selling or distributing unauthorized electronic nicotine delivery systems that includes e-cigarettes that did not submit pre-market applications by the September 9th deadline. Collectively, these companies have listed a combined total of over 1.2 million products listed with the FDA. We're also expanding our critical public education efforts through the Real Cost Youth E-Cigarette Prevention Campaign. We're targeting over 10 million teens who've used or may use e-cigarettes. The most recent impact assessments of the real cost are promising, indicating the various elements of the campaign have received over 5 billion views, and that 75% of youth are aware and receptive to our ads. Over time, increased exposure to the campaign is expected to increase population-level shifts in youth beliefs about e-cigarettes. As a science-based agency, we now support more than 145 e-cigarette research projects. This research helps us better understand and regulate these products and includes investigation of use behaviors, addiction, and health effects. We also continue our yearly surveys and studies we undertake with federal partners at CDC and NIH. In closing, I give you my commitment and speak on behalf of my colleagues at the agency that we will do all we can to prevent kids from using tobacco products and to address the current youth vaping epidemic. We'll do the hard work, we'll support innovative and informative research, and make science-based, data-driven decisions as we follow through on this very important aspect of our public health mission. Thank you for the opportunity to testify. I appreciate the subcommittee's efforts on support of the agency and your efforts to protect kids especially from the dangers of tobacco, and I'm happy to answer questions. Thank you.
Thank you, Commissioner Woodcock. I now recognize myself for questions. If you could please put the first chart up. Commissioner, I'd like to start by directing you to the NIH Monitoring the Future survey data published in 2019 and 2020. This is a chart showing that among a subset of almost 9,000 high schoolers, this NIH study found that the percentage who said they vaped in the past 30 days equaled 22.5% in 2019 and 22% in 2020. Now, back in May 2019, you described youth e-cigarette use as a, quote, alarming problem. I assume you continue to believe that sentiment, correct? Can you repeat that? I think your mic is on.
Sorry. Yes, I do.
At the same meeting in 2019, you said, quote, e-cigarette use among youth also increases the risk that they will use combustible cigarettes, close quote. You still believe that, correct?
I believe that is the case.
According to FDA's website, quote, nicotine exposure during adolescence can disrupt normal brain development and may have long-lasting effects such as increased impulsivity and mood disorders. You don't disagree, correct?
I don't disagree with that assessment. It's very concerning.
Now, as you mentioned in your opening statement, you've received millions of applications under the PMTA standards, and one of the things that the FDA must assess is, quote, the increased likelihood that those who do not use tobacco products will start using such products. When youth who use e-cigarettes that might be subject to the PMTA process have an increased likelihood of using other tobacco products such as combustible cigarettes, that's a problem under the PMTA standard, right?
Yes.
The PMTA standard also states that you must consider the quote-unquote risks to, quote, people who would use proposed new tobacco products under the PMTA. We just talked about the health risks to youth. I presume that, again, those health risks, those significant long-term health risks to youth are, again, a problem under the PMTA standard, right?
Absolutely. That's the harm bar. That's the bar that has to be overcome by benefits in order to have a net benefit in the public health.
Very good. In your June 22nd letter, so last night, the good folks at FDA sent me a letter late saying, quote, the assessment of a new product's likely impact on addiction, especially among youth, is critical to determining whether allowing a new tobacco product would be, quote, appropriate for the protection of the public health. And then the letter goes on to state, one of the issues bearing on your assessment of addiction was, quote, the levels of nicotine in the finished product, close quote. I'd like to now present you with some documents that Jewel produced to our committee during this investigation. I seek unanimous consent to enter Exhibits A, B, and C. Without objection, so entered. Clerk, can you please display the next slide?
Oh, thank you.
This is a March 2016 Jewel document that was produced as part of their document production to us on this committee. It says, quote, this is an internal document from an employee at Jewel. It says, quote, based on feedback from retailers, customer service, and social media, many consumers feel that 5% nicotine strength is too strong. Our current nicotine level in pods is much higher than other e-cigarettes. And by the way, as you know, this 5% strength is the strength of current Jewel products. That was in 2016, 5 years ago. Now let's go to 2018, when 20% of high school students and 5% of middle school students were vaping. Can you please present the next slide, Rich? Jewel convened something called a Youth Advisory Council to ask why so many children are using its product. This is what Kim said. Kim said, very high concentration of nicotine. And then she has some other interesting comments there. I didn't put this up on a slide, but Brett said, quote, social acceptance to start, addiction to nicotine keeps them. Noah said, quote, social to start, nicotine to stay. Besides this anecdotal evidence, Commissioner Woodcock, there's objective data that even as late as 2020, the National Youth Tobacco Survey that came out from the FDA shows an increase in nicotine addiction. According to FDA, almost 40% of high school users are using an e-cigarette on 20 or more days out of the month. That's every 2 of every 3 days. These numbers are up from 2019 when that number was roughly 34%. So in your assessment of a new product's likely impact on addiction, going back to the standard that you set forth in your letter to me with regard to PMTA, you'd be very concerned about youth perceptions as well as the reality of a product's addictive qualities, correct?
Absolutely. That has to be in the forefront of our assessment of harm, potential harm.
You'd also be concerned about a company's knowing decision to keep its nicotine levels high, even in the face of internal employee, as well as retailer feedback that it's too high?
Obviously, for substances that can cause addiction, exposure is very important, and higher exposure is a problem.
And also, you'd be concerned about youth data showing that it's hooking or addicting kids, right?
Absolutely.
When a company has such internal data and continues to keep its nicotine levels high, does that fact present evidence that the company intended to hook kids?
I guess I'm not a lawyer, so that's beyond my area of expertise. I would say that the facts of the case show that these products had real dangers to kids.
And the companies knew about the dangers.
According to what you show here, absolutely.
In February 2020, FDA implemented a new, we call it flavor ban. There's a much longer title. You're familiar with that flavor ban, correct?
Yes.
According to the policy, however, it made 2 exemptions. First, it made an exemption for tobacco and menthol flavors for Juul and other cartridge-based devices. And then second, it made an exemption for all disposable e-cigarettes to be in any flavor whatsoever. Let's talk about menthol for a second, Commissioner. Can you present the next slide? 44% of youth in 2019 used mint Juuls. And when mint was banned in February 2020 under your partial flavor ban, guess what? 44.5% of youth used menthol Juuls. So we went from 44% of Juul users using mint to 44.5% of Juul users using menthol. And as Senator Durbin said in his testimony, 62% of all users, regardless of which company, ended up using menthol. Now, Commissioner, this was before you became Commissioner, but I spent an entire hearing in December 2019 with your colleague Mitch Zeller telling him that this was such a bad idea to create an exemption for menthol. I said, this is exactly what's going to happen. People are going to migrate from mint to menthol, and that's what happened. Now, I was so pleased that you banned menthol combustible cigarettes, which was the right thing to do. Will you pledge to clear the market of menthol e-cigarettes?
Again, I can't prejudge our decisions. What I can say is that menthol has additional properties and pharmacologic properties that I believe potentiate the effects of nicotine addiction and make it harder to stop either vaping or smoking. And so it's, to my mind, like actually having a higher concentration of nicotine in your whatever delivery system.
Well, that's enlightening. It basically heightens the addictive properties of the e-cigarettes.
That is my belief based on the data. I don't think it's a totally settled, but evidence shows it's harder for people who smoke menthol cigarettes to stop smoking, even though they smoke fewer cigarettes. Those facts are compatible with that hypothesis.
Let's talk about disposable e-cigarettes. According to the 2020 NYTS that you folks presented at the FDA, in 2019, only 2.5% of high school students, 2.5% of high school vapers used disposables, But after FDA banned most flavors for cartridge devices but allowed all flavors for disposables, guess what? Disposable use surged to almost 27% in 2020. You don't dispute that data, correct?
No?
The decision to exempt disposables, again, was made before your time as commissioner. Exempting disposable e-cigarettes was a huge mistake. Exempting them from the flavor ban was a huge mistake. I assume that you consider that problematic. Will you pledge to close the disposables loophole in the flavor ban?
Again, I can't prejudge our decisions, which are coming up very quickly. However, I think this switch to a different alternative method of flavored cigarette rather than staying with the, say, tobacco-flavored Juul is another piece of evidence that the youth really prefers the flavors, and that is a really important factor for the youth in sustaining their use of these products.
And in fact, the percentage of youth who use flavored e-cigarettes went up over the last year since the partial flavor ban. Now it's up to 80% of youth use flavored products, correct?
I can't remember all these numbers exactly, but it's a very high number. I believe it is 80%. Yeah.
Very good. Let me now recognize Ranking Member Cloud, and I'm sorry I think we forgot to turn on the timer, so we'll give you some extra time here.
It's a liberal 5 minutes. Thank you again for being here, and thank you, Chair, for the important discussion on this topic. As we all have agreed, we don't want to see these in the hands of our kids, and we want to see what we can do to have it. You mentioned that some progress has been made in 2020 and that there's been some reduction in youth vaping, according to the data. Now, and granted, on whatever topic we're talking about, 2020 is a year that it's hard to really put any stock in a lot of definite data. So I'm curious to know why you think that happened. Did the T21 legislation that we passed have anything to do with that? Was it some of the administrative actions that were taken? Also curious to know, as we're looking ahead, like we said, 2020 is kind of a hard year to be definitive about when it comes to data on any topic. But when we can expect to see data that we can kind of see if those trends are moving in the right direction or if it was a blip because of COVID and all those kind of things. What are your thoughts?
Well, the data from surveys should come out. Hopefully, we will have some indication of that later this year to give us another year of data. I think because the survey has already been conducted, so the analysis must be done and so forth. I believe that the apparent decrease last year was probably multifactorial, and so it's hard to say what the contribution of any given factor was. The children, a lot of them were at home. They weren't suffering as much peer pressure. They were very unhappy about not being around their peers, but a lot of them were not in congregate situations. And we heard from the film that you showed, we heard that peer pressure, and in this binder, that peer pressure was a very important factor in some of these kids using vaping products. So the ban on the T21, I think, is very helpful. FDA, though, had to stop its compliance checks in the middle of the pandemic because we used underage children as part of the test subjects, along with a trained adult to go in and attempt to purchase, and we couldn't send children into those circumstances with COVID. So, but I will say that even before, even when we had the limit at 18, we saw thousands of cases where sales were made to under 18 individuals. So that's a problem out there, that those retail outlets still will sell to underage individuals.
There's been I'm a little concerned about the timing of this hearing. While I think it's very important topic that we cover, and you to be here is great, just because courts have frowned upon in the past Congress weighing in while there's an agency investigating or reviewing a topic. And as a matter of fact, Pillsbury Company versus FTC held that congressional investigation cannot be focused on intervening in an agency's adjudicative function. How are we going to make sure that today's hearing is informative for us, informative for the American people, but that your decisions are going to be evidence-based? I noted some of the comments you made, talked about what you believe to be the case, but didn't cite any data. I realize you have a team and a staff, and you can't be expected on every topic you cover to know everything, but how are we going to ensure that as we move forward in this process that it's going to be evidence-based?
Well, as I said, I cannot in this hearing prejudge any decisions we will make or commit to any given actions. The Congress has laid out in statute what the statutory bar is for these for this review program, and it's a rather high bar. I don't think that's a matter of dispute, but certainly the agency scientists are hard at work at evaluating these applications against the criteria that are laid out in the statute, and that is the process that we will follow.
Is there evidence coming to play that shows that there is a use for adults, now we're talking over 21, to use vaping products as a smoking cessation device? Is there early evidence of that?
I think the studies are somewhat mixed. As far as how effective vaping is.
It's a new industry, so I realize
no
it's developing.
Company has come to the FDA Center for Drugs to go through the process as smoking cessation, right, which would be a drug indication and is a different process you would go through as a drug. We have a number of cessation products on the market. They've all been shown in clinical studies to help people stop smoking, although the adherence to stopping smoking over years may not be that good. But these, including certain drugs, as well as different nicotine products that people can use as nicotine replacement and help stop smoking. In all those cases, people are urged to also get counseling or be in a program or something like that. That helps a lot of people with smoking. So none of the vaping products have been through that kind of process, which requires clinical trials to prove that you can actually get people to stop smoking. I think
you can advertise it as that.
Pardon me?
That they could advertise it as that kind of product.
They would have claims then. They would be a drug, and they could advertise, absolutely. But they would also have to do toxicologic studies on their products, inhaled products, and so forth. So in the statute for tobacco products that we are reviewing under says it also has an evidentiary statement in the statute that says, there should be studies that should support the benefits, and those could be clinical studies or other type of studies. So the burden, as Senator Durbin said, is on the manufacturer to show that by some studies and data that their product has some public health benefit.
I don't know if you would have this data handy. If not, I'd be very curious to have your team look into it and see. But as we've coming through this year with COVID-19, it's a respiratory illness, and we know that it affected particularly seniors and other demographics particularly hard. But there were some cases where young people were tremendously affected by it. Some died, while that was much more rare than other segments of our population. Have you all cross-referenced that with vaping to see if there was a connection to be susceptible? And then, in the past, we've covered this in a number of hearings, so we understood that there's a distinct difference even in the effect of black market products and versus others. Not that you should have any of them. That's well established, I think, at least among us who are talking about this issue. Have you found any sort of connection?
Yeah, I don't think the data are available to link COVID, severity of COVID, or catching COVID by youth or having a severe case with vaping practices. I can get back to you. We can look at what data might be available, but I do not think those data are available. The youth use of COVID usually wouldn't be in the medical record. I mean, the use of, of vaping wouldn't be in the medical record. And so then it's hard for people to make that connection.
Right. Okay. Well, thank you. I yield back. Thank you, Chairman.
Thank you, Mr. Cloud. Now I recognize Congresswoman Porter for 5 minutes.
Thank you very much, Mr. Chair. Commissioner Woodcock, does the research clearly establish that flavored e-cigarettes appeal to children?
Yes, I believe it does.
And in fact, the FDA banned non-disposable flavored e-cigarettes, except menthol, in order to, quote, limit children's access to certain flavored e-cigarette products we know are so appealing to them.
Yes.
But we're having this hearing because disposable flavored e-cigarettes, and both disposable and non-disposable menthol products, are still on the market. And the inevitable result of this is that e-cigarette use among high school and middle school students is incredibly high. 3.6 million children, youth vapors in 2020. Dr. Woodcock, of those middle and high school kids who smoked e-cigarettes, what percentage of them used flavored products?
I believe that 8 out of 10 e-cigarette users report use of flavored products.
That's what I have too, right about 83%. And that was an all-time high. So if any flavor, other than tobacco flavor, of e-cigarette is left on the market, is it likely to encourage youth to start vaping?
Okay, the statutory bar that we're talking about is that harm, okay, the harm of...
Oh, reclaiming my time, I'm going to get to that balancing act.
Okay.
So I'm going to let you do that balancing.
Yes.
So you're going to have to balance. But what we're balancing on the other side is, I want to establish, any flavor of e-cigarette left on the market is likely to encourage youth to start vaping. And we have to balance that against some other things we're going to get to. Is that correct?
That's correct.
And if the FDA banned all flavored e-cigarettes, would less kids continue to vape among those who have started, in your opinion?
Well, I can't predict the future. I think that might be likely. We also would have to, regardless, limit advertising and sales and targeting children and other practices.
Well, if they're not on the market, it's tough to advertise them, right?
Well,
so to summarize, if kids have the choices of any tasty flavor, they're going to go for it. And I'm speaking to you from experience here as a mom of 3 school-age kids. If there are no watermelon snow cones, my kids are happy with blue raspberry. No blue raspberry, they'll take mango. No mango, they'll take strawberry. But if their only choice was a brown tobacco-flavored snow cone, they are going to walk away. So right now, the FDA is analyzing what are called pre-market tobacco product applications. And in short, and this is what you were hinting at, you have to decide whether or not an e-cigarette can bring or keep a product on market. And in doing that, you have to do that only if it is appropriate for the protection of public health. That is the standard. And what this means is the FDA is required, as you were saying, to balance youth vaping against any good that e-cigarettes might do in getting adult smokers to quit tobacco products. Commissioner Woodcock, do you know what percentage of adult smokers use e-cigarettes instead of traditional cigarettes?
No.
It's about 4.5%. So we're talking about a very small fraction of adult smokers in general use e-cigarettes. And do you know of that small group of adult e-cigarette smokers, do you know what percentage prefer menthol or mango, or if there is a blue raspberry, over tobacco flavor?
No.
So a study in Great Britain, we don't have a study yet in the US, found that 56% of adult vapors, people over 55, prefer tobacco. Do you know how many kids like tobacco flavor?
I believe it's a very low percentage, but I don't know the exact amount.
Yeah, 1.1% of youth vapors. I mean, the number of kids who like broccoli is many, many multiples of that. So it's really important, I think, that you have that information as you go to do that. The Surgeon General has said that there is zero real evidence, scientific evidence, that proves e-cigarettes in general help adults quit smoking. That's what the Surgeon General has said. You have testified that kids are drawn to flavored e-cigarettes based on the evidence. And as a mom of 3, hopefully, non-vaping kids, this is pretty personal for me. The only way to protect our kids is to deny pre-market tobacco product applications for every flavored e-cigarette other than tobacco flavor. Will you commit to doing that?
As I have said already, I can't prejudge the scientific.
Reclaiming my time, Dr. Woodcock, you may not be willing to do it, but I just want to make sure America understands. You have the authority to commit today to preventing millions of kids from becoming addicted to vaping by making the decision and the commitment today to us. And if you don't make that decision today in this oversight hearing, then the alternative is going to be years and years of delay while Congress tries to pass a bill and millions more of kids getting addicted. So I hear you. You're not willing to make that commitment to youth today. But I do want the American people to understand you do have that power. I yield back.
Thank you, Congresswoman Porter. I now recognize Congressman Keller for 5 minutes.
Thank you, Mr. Chairman. Youth vaping is an epidemic that puts the health of our children at risk. Even after the federal minimum age of the sale of tobacco products was raised to 21 years old, and flavor bans were enforced in 2019. In January of 2020, the CDC found that almost 20% of high school students vaped in the past 30 days. That's unacceptable. We need to focus on getting disposable e-cigarettes out of the hands of our children. While tobacco itself is not an illegal product, we must ensure that guardrails are set in place for the overall health and benefit of all Americans, especially those too young to understand the danger. These products are not subject to the same flavor guidance as closed-system electronic nicotine delivery systems. We need smart and targeted solutions for these problems. So, Dr. Woodcock, I appreciate you being here today. Thank you for that. And I just was wondering, could you give us an update on what actions the FDA plans to take to protect the health and safety of kids while taking into account the mom and pop or the small operations around the country that require sensible regulations?
Well, according to the law and the court order that we're under, by September 9th, we will come to a decision on these